That's it. Nothing else.
New York Governor Andrew Cuomo trying to make testing look easy, asking sick New Yorkers to follow his lead.
We want to test as many as we can possibly test.
The state is looking to build a massive pool of test results to feed an ambitious contact tracing program. 17,000 specially trained workers retracing the steps of infected people trying to isolate new outbreaks.
We estimate that we need at minimum 30 contact tracers per 100,000 people.
But some states are nowhere near that benchmark. Florida, for one, some 5,000 tracers short. And in suburban Cook County, Illinois, near Chicago, the 30 to 100,000 benchmark means some 750 tracers. Right now, Cook County has about 30.
We need to get to those folks as early as possible.
Dr. Karan Joshi is a physician who advises the Cook County Health Department.
Even in normal times, it's a challenge to stay on top of all the infectious diseases that our communicable disease unit deals with on a daily basis. But given the real tsunami of cases we've seen over the last few months, it's difficult, as you can imagine, to reach out to every single case individually, let alone their contacts.
The department says it will work to hire as many as 750 more tracers when it has the funding for it. In a country with at least 14% unemployment, an army of tracers could cushion the blow. This posting in San Diego already closed because of an overwhelming number of applicants. Tracking and notifying anyone who might have been exposed is complicated, even if everyone answers the phone and responds to questions honestly.
Sometimes, people don't want to be in trouble or feel like they're getting somebody else in trouble because they know that they're going to be asked to stay home for 14 days.
Around the world, governments are digitally tracking residents. Singapore using an app that relies on Bluetooth, and India is requiring all railway passengers to download its version. Contact tracing raises privacy concerns, especially in the U.S., a country built on personal choice and sensitive to privacy. Apple and Google are building tracing software, but they don't want to share the data with health officials. And in order for it to work, two people would have to voluntarily decide to download it.
I would very much look at the app that I was giving those kind of permissions to make sure that that information is getting to the right people where it can be helpful, and I'm not just giving up my own personal data for no good reason.
It's going to be the biggest mobilization of local public health in our lifetimes, and our intention is to move forward thoughtfully.
James Packard, Newsy, Chicago.